Can you tell me a little bit about what we treat at launch centers?
Absolutely. So at launch centers, we work with what's called a dual diagnosis client. So that's just a fancy clinical term for, hey, we work with clients who struggle with both mental health and substance use. Some of our clients come in with just substance use, some just come in with mental health. At the end of the day, at launch, what we're really treating is young adults. So we really have tried to focus on age-specific treatment. So we really focus on things like values, identity. Who are you? What do you believe in? What's important to you? What's meaningful to you? We focus on relationships and community. How do you connect with others in a meaningful way? We try to focus on self-esteem, self-worth. How do you become the most authentic version of yourself, right? And these things are also very evidence-based, right? We have lots of evidence-based treatment that we use as well, but these are things we know help people to increase their mood and to feel better about themselves. These are things that we know improve mental health outcomes. These are things that we know help people get sober, right? And a big piece of that is that community piece. And so one of the things that's really special about Launch is that because all the clients are around the same age, the community is really strong, right? The cohesion among the clients is really strong. They're all going through a similar life stage. So there's something really special about that, right? Like they're able to really connect with each other in this really meaningful way because they're all kind of going through the same stuff, even if they're at a different stage on that journey.